Hello, everyone. Thank you so much for joining us today. Looking forward to taking the next 90 minutes or so and discussing some of the advances that we've seen in sexual health education. So we're here today in particular to talk about global sexual health education with the World Association for Sexual Health Sexuality Education Committee. So I'm Dr. Kristen Mark. I am the Joycelyn Elders Endowed Chair for Sexual Health Education at the Eli Coleman Institute for Sexual and Gender Health at University of Minnesota's Medical School. So I am very entrenched in the sex education world and look so forward to hearing from our colleagues today about the kinds of challenges, successes, and directions that sexuality education will take going forward globally. We have several colleagues with us today, and they're going to speak to their work in their regions of the world. And we were hoping that we would get to hear from one of our colleagues, Dr. Atsu David from West Africa. Unfortunately, we'll miss hearing from her today, but we do encourage any of the West Africa or other components, other areas of Africa colleagues who are with us today in the participant capacity. If you, we will have lots of time in the discussion, and we would just love to hear from you in that portion of the talk. So also, let me just give you a little bit of an overview of what to expect for the next 90 minutes. We will first start with a framing of the conversation with something that is near and dear to my heart and to my sex education efforts of using storytelling as a way to really contextualize the importance and the impact that sexual health education has on individuals. And so Dr. Patti Britton is going to frame that conversation with a sex education story first. Then we'll dive in with a summary of where the WAS Sexuality Education Committee is now and where they're going from Dr. Esther Corona, who is based in Mexico and is a clinical psychologist who's worked on sexuality education, sexual and reproductive health and gender for over 50 years. I'm sure many of you in the audience are very familiar with Dr. Corona's work. And a very impressive list of accomplishments during that time, especially within the context of WAS. She'll speak also to the WAS committee and its response to the current challenges that we face worldwide. Then we'll hear from Dr. Margarita Gerouki of Greece, who is an educator, educational advisor, and a researcher in relationships, sexuality, and gender education. So she'll provide us with an update on the Greek struggles and also successes and directions forward in the Greek context of sexual health education. Finally, last but not least, we will hear from an update on Latin America. And this will come from Mariana Cruz, who's been instrumental in advancing our comprehensive sexuality education and gender strategies across Latin America. Then we've left time at the end where we really would like to engage with all of you. We want to, I'll facilitate a discussion amongst our panelists and also the audience. And I encourage you to use the question and answer feature that is located at the bottom of the Zoom. And we'll try and answer all of the questions and hopefully can engage in a really rich discussion. And I love seeing all of your hellos from all over the world. So although we are covering 3 different sort of areas of the world in today's talk, there's a whole wealth of knowledge in all of you as well with the sexual health education efforts that all of you are working through. And so I really hope that discussion can include some updates from other places in the world. So I'll turn it over now for Dr. Patti Britton to tell us a story. Thank you for being here.
Thank you so much. I am so thrilled and honored to be here as a longstanding member of the WAS SEC, the Sexuality Education Committee. So the title of my talk is We Must Do Better. And this is my story with comprehensive sexuality education, or we call it CSE, having spent almost like Esther, the past 45 years in sex education and the past 30 years as an ASEC certified sexuality educator. My story has always been about sex ed. My story has always had a theme that we must do better. Better for ourselves and better for the children that grow up to become the clients of sex therapists, counselors, and other practitioners when sex or their sexuality is not working for them. And that usually is due to shame and ignorance. We all know that sex ed saves lives. CSE leads to sexual justice for all. So my story, for me, it all began in a small town classroom in the 1950s when all sex ed started with the word don't. In my health class, the girls and boys were separated. And when the school nurse showed the horror movie about periods, and the lectures were all scare tactics to avoid sex at all costs. To paraphrase our colleague Marty Klein about the Christian conservative movement's sex education in the United States, he says, quote, "Sex is wrong, dirty, and shameful. Save it for the one you love and marry," end quote. Oh boy, we can do better. So for me, with barely a sense of what sex even was, other than the nuisance of having to wear a huge cotton wedge between my legs once a month, I somehow morphed into a sex educator. I had the privilege of becoming a rural health educator for Planned Parenthood in the state of Vermont, knocking on strangers' doors in poor neighborhoods, where barefoot young children played in the dirt as their young mothers stood in the doorway with swollen bellies, pregnant again. I was doing sex ed on the spot and getting them into family planning clinics. We could do better. As the deputy director at SECUS in 1990, I was the person who was tasked to release the very first guidelines on comprehensive sex education K through 12 nationwide. I led the very first national coalition on sex ed. We produced a nationwide report on HIV/AIDS education in the nation's public schools. And we led comprehensive sex ed teacher trainings for those 3 years that I was at SECUS. That was after pioneering the very first HIV/AIDS teacher training project funded by the United States Centers for Disease Control to prevent the spread of HIV in our nation's schools. We had to do better. As Associate Director of Education for Planned Parenthood Federation of America, I became active in support of CSE. As little CSE existed formally, and the typical sex ed was brought into the classrooms or into the communities by Planned Parenthood sexuality educators. As a Planned Parenthood sexuality educator, we were known as the sex lady, avoiding unintended pregnancies and STI prevention. Those were our messages. Even then, school boards were not eager to approve CSE for their kids. For myself, my story continues. I've been the president of the Foundation for the Scientific Study of Sexuality, served on many Society for Scientific Study of Sexuality committees, on numerous ASECT committees. I was even the elected president of ASECT from 2007 to 2009. I've served on the board of the Woodhull Foundation, on the WAS Advisory Committee, and I'm really honored and proud to be a longstanding member of the Sex Education Committee at WAS. I also was one of the founders of the WAS North American Federation, which at that time was called NAFSO. So I've seen and been through the evolution and maybe the disevolution of CSE in many forms and many forms. My work now is sex ed for adults as I train and certify sex coaches or other sexologists around the world. So here's what strikes me. What strikes me right now is that the current political climate that we are all facing means that we are sliding backward. These are dangerous times. Attacks on comprehensive sexuality education are on the rise, whether it's about LGBTQ plus issues, the promotion of abstinence-only agendas, fear-based versus pleasure-based teaching, or even the removal of classic books from threatened library shelves. I hope that this webinar today is a rallying cry for all of us to take note, to take action, and to agree. We must do better, and together we can. Thank you.
Great, thank you so much. I would love to turn us over now to hear about the grander context within which the committee has been doing their work. So I'll turn this over to you, Dr. Esther Corona.
Thank you very much. And first of all, I'm absolutely thrilled also to be here this morning for us, afternoon and evening for wherever you are, because I'm seeing that we have people from all over the world, from ranging from India, Iraq, all over the Americas, Africa, and Europe. So it's very, very exciting. As you have, as Kristen has mentioned before, I am the co-leader, co-chair of the Sexuality Education Committee at WAS. And here I would like, first of all, to extend a greeting to our chair, Dr. Osmo Contula, who unfortunately cannot be here with us today due to health issues, but he has been a fearless leader in this field for some time. So we are very happy to do and continue the work that he has been doing for WAS. And that is the reason I'm leading this committee right now. First of all, I want to specify something because I was a little bit struck by the title of this webinar, Sexual Health Education. Sexual health education, well, the fact is that what we call comprehensive sexuality education goes by many names in many parts of the world, particularly when we speak in different languages, where it takes, because of translation, different guises. But even so, what it is very important to mention is that we are talking about sexuality education that has certain components. I'm always reminding of Shakespeare, you know, and Romeo and Juliet, asking, you know, what is a rose? A rose by any other name would still be a rose if it had the aroma, if it had certain characteristics. Which are these in sexuality education, CSE? Well, it has to be rights-based. It has to address the whole life cycle. It has to have a gender perspective, and it has to be also an approach in a very sexually positive way, and also recognize diversity, recognize, and when we talk about positively in this approach, we're talking also about pleasure. So these are the non-negotiable areas when we talk about sexuality education. Call it skills training, call it what you want to call it, but be sure that the components are there. So what we have been doing at WAS, we instituted a sexuality education committee about, I should say, in the early in the century, before we didn't have a sexuality education committee, although WAS was started by a group of sexologists and a large group of sexuality educators. So when we started, of course, it was slightly difficult to get together what we were trying to do. But we were very fortunate that over the years, one of the areas that we instituted was a Sexuality Education Award. And this award has become well recognized, and also it has become very, people want to get it. Now we have lots of applicants, of applications, whereas in the early years, I remember maybe 1 or 2 times that we had to cancel the award because we didn't have any applications at all. Now, our committee has this task of examining all these applications and coming to sometimes very difficult decisions, because we have limited awards and we have so many excellent persons, programs, academic institutions coming into the field. So our committee that you will be seeing, here we have 3 of our group. That's Margarita, Patti, and Mariana are here. We are missing, unfortunately, Karen Rain, who's doing some work in Spain at the moment, and also our African representative, who's not able to be here, and the same with we have a Japanese gynecologist doing sexuality education within, I wouldn't say difficult settings, because they are not as, the opposition, it's not raging as everywhere else. But we do have, but they have some cultural issues that don't allow, the expansion of this field. And she's doing fabulous work. So we have people from all over in the committee. We have professionals from all over the world. And what is more important, they are all very committed, doing incredible work, as you will hear very soon at least from Margarita and from Mariana in certain regions of the world. And we hope during the discussion and Q&A, we can bring in some more of the work of other people who are, I would love to hear what's going on in Eastern Europe, in the Middle East, and Southeast Asia, etc. Because we also want to encourage to join WAS and to join the committee, because we need, as Patti has already said, to do better in terms of increase our work, have it more evidence-based, do more research, and also do more training all over the world. And we also have to face the enormous onslaught that we have against sexuality education and other sexual related issues right now all over the world. This is not happening in Latin America. This is not happening in Europe. It's happening everywhere. And it is part of, let's face it, the world divide. We are entering, I don't know if entering, but we are facing right now enormous political, economic, and environmental challenges. How cannot, and so we must face all these challenges also not in a separate way, not in silos, but we must face all these issues in a concerted way, because I think they're challenges not against a certain area, a certain group, they're challenges against humankind. So I do hope that we have the chance through this webinar, and then later on through our work of the of WAS, all of WAS, through all the work that we do through the Sexuality Education Committee at WAS, and a new initiative that we are starting precisely to face all these areas in a more comprehensive, intersectional way, which is a sexual justice initiative, of which, of course, sexuality education is a major component. We will be addressing this issue, and we will be talking about it extensively during our next Congress, which will be happening in Antalya, Turkey, in November, early November. So what I mean is that at WAS being an international organization, and that's the reason that I'm so happy to see that we have an international audience, because only by joining forces, only by taking our own cultural challenges, but transforming them and seeing how they relate to the international challenges, by not isolating ourselves, but by really saying we are part of humankind. We are part of this group that must face enormous challenges, and we must go and move forward. Sexuality, as we have seen through our evolutionary history, has been, I think, crucial in making us today what we are. I mean, the transformations from all the early hominids into it's called Homo sapiens, but I hope that we change something to human sapiens, and we really become human sapiens in terms that we draw from our past experience and precisely how we have become sexually interesting, how sexuality has moved us forward in terms not only of reproduction, but now of linking us together, of relationship. And how can we transform this sexuality? How can we move it forward to precisely build us into better persons all over the world? So I just hope that WAS work will be able to continue. Our vision will be able to focus on these intersectional areas and move us forward and help us to do better, as Patti Britton has just said. Thank you.
Wonderful. Thank you so much. Great context for us to now hear from some very specific parts of the world. So let's move on over and take a look at what's happening in Greece. So Dr. Margarita Gerouki, would you please take it away?
Thank you. Thank you so much. And thank you for the invitation. And it's a great honor to be here today. And I would like to share a short presentation. Yeah, I think you can see that. And I'm Margarita, and I want to talk about comprehensive sexuality education, CSE, and I will use the Greek puzzle as a case study. I really feel from listening to Esther and Patti that the struggles we're having in Greece are not Greek struggles. They are struggles all over the world. So, but before, Greece is a small country at the south of Europe. I put it there in the middle of the map. It's about 10-11 million people country, the vast majority baptized Orthodox Christians. It's a Western country and part of the European Union since 1981. Many people around the world know Greece as a big because of its ancient past, antiquity, the contribution of the ancient Greeks to science and arts. And of course, for many people around the world, Greece is a popular tourist destination. So I would continue with a little bit of my story, as Patti has mentioned. And my story starts there 30 years ago. And that was my first class of students, sixth grade students in some school in Athens area. And this was the first experience when I realized that as a teacher, and I can confirm what I believe most of the teachers, not sexuality education teachers, all kinds of teachers can agree with, that our students in the classes are wondering, pondering, want to know, have serious questions for all the themes around their body, their sexuality, the way they're growing, and the way they can form safe and healthy relationships in the future. So that was my realization 30 years ago. And that was the second thing, was that I was totally unprepared as a teacher to discuss these issues. And that opened my way 30 years later, having many more studies in health education and sex education. I am here discussing what is happening in sexuality, regarding sexuality education in Greece, which is something that I have been involved the 25 past years. So I have a short roadmap for you. So in 1964, the General Secretary of the Ministry of Education of that times referred to sex education as something very serious and very important that we have to discuss officially in Greece. And this announcement followed by about almost 50 years of silence. Nothing had happened until 2000, the year 2000. We have some sex education textbooks for the secondary, and these were made with EU funding. In 2003, sex education became a thematic unit of health education in the national curriculum, and teachers were optionally, it was an elective topic, but teachers could discuss sexuality, sexual health, and sexuality issues with their students in class. In 2008, we had some more books, again from an EU funding, and these books were created for the primary school. Another important step was in 2009, the Minister of Education of the time, he made a public announcement, and he said that the introduction of sex education is going to be issued in the schools starting from grade 5. But then we had the change of government, and that somehow project died with the change of the government. In 2019, some teachers and a team of teachers, and I was part of that team, received the WAS award in innovation, excellence in innovation in sex education, for our work of Play with Frixos, sex education materials that they were for children from 5 to 8 years old. And that award somehow started a public discussion about properly appropriate teaching of comprehensive sexuality education in Greece. So at the same time, we have the public pressure to discuss sexuality education, but also the opposition against sexuality education. 1 year later, we had the Me Too Greece. There was a public attention to cases of child sexual abuse and gender-based violence in Greece. And that Me Too Greece also opened some doors for the introduction, for deciding, for introducing sexuality, comprehensive sexuality education. And 1 year later, 2021, the Ministry of Education decided on compulsive sexuality education courses, 7 hours per year, for the years for kindergarten, the years 3rd, 6th, and 8th grades. And 2 years later, now, we have, in our recent parliamentary elections last month, we have some strong representation in the parliament of groups that their agenda are anti-CSE, their rhetoric and is against abortion and against inclusive education and LGBTQ issues. So we are here, and I have this divide because I would like with this divide here to represent what I call the decades of silence. So sexuality education was just a rhetoric for those who were not living in Greece, for example, for those in EU. And after 2019, when we have the years of visibility, but at the same time, the years of visible conflict, where more people discuss the need for appropriate introduction of CSE, but at the same time, anti-CSE groups are becoming more organized and gain representation. So the question is, why do teachers do not teach sex education in Greece? And when sex education was optional, only 1.6% of teachers were opting for a sex education course in Greece. But even now, the last 2 years, when it is compulsory, then still teachers are not willing to introduce sex education in their classes. And I hope that in the Congress in Antalya, we could have the opportunity to present some Greek research, recent research on teachers discussing exactly this unwillingness to introduce sex education teaching. Why this is happening? This briefly is 3+1 reason. So the first reason is that teachers have not received any proper training and education, whether they're pre-service teachers or in-service teachers. So our universities are not involved in sex education teaching, or just very few. All teachers realize that they have not received any kind of proper education, sex education, when they were forming their qualifications. So not appropriate education for teachers is one obstacle. The second obstacle is the materials. We do not have teaching materials, and we do not have a proper curriculum for introducing sex education in Greece. If you remember, I referred to some books for the secondary and the primary created in 2000 and 2008. Already too old, but these books were created, published, but they were never introduced in the schools, and teachers never received education how to use them. They've never seen the books themselves, actually. So, and nowadays this is a second big obstacle for teachers, because they don't have any appropriate or enough appropriate materials to do their teaching. And the third one is that there are ambiguous messages regarding sexuality education policies. And this is what I want to show here. This is from a book from the first grade, where the topic of the book is getting to know my body. And this is the picture that technically gives the message to any teacher in this world that we don't discuss genitals. This picture discussing the body with a cover body for boys and girls, it's very indicative of that notion. We don't have appropriate curriculum. Actually, the website of the Ministry of Education, there is just one paragraph regarding sexuality education teaching. And although that paragraph uses all the right words about inclusion, human rights, gender equality, respect for diversity, however, this one paragraph is not enough for the teachers to be safe in teaching. And then there is something else. when sometimes teachers are trying to teach, they're being persecuted by either court or the media. And I will give you two examples. In 2019, if you see here, some kindergarten teachers were taken to court because they discussed with their students the genitals. They have used materials that they have been approved by the Ministry of Education, and actually this trial was postponed because if you see, that was exactly the same week where there was conference in Mexico, when me and my team, we were receiving the award for the same materials that the teachers were taking to court. So this is a strong message that the teachers get, that honestly, I cannot really involve in that. That trial happened many years later due to COVID problems. And of course, the teachers were not found guilty. But still, for all these years, it was a big discussion, and the message to the teachers was really do not mess up, do not teach sex education. You might end up in court. And if you think that 21 is old times, let's talk about last month. So on 24th of May of 23, a Greek newspaper article referred to a primary school teacher who chose to show this film, Shower Boys, awarded film by a Swedish director, Kristen. According to that article, two parents were disturbed by the choice of the film and sent a court appeal to the teacher, to the principal, to the Office of Primary Education, even to the Ministry of Education itself. And they demanded to be informed whether the film is educational film and approved pedagogically. The lawyer of the family stated, and I quote, "This is obscene and vulgar propaganda in favor of homosexuality between minors by the school teacher. The movie Shower Boys reinforces homosexuality between males. The students who watched the film were shocked, while some children were behaving strangely when they returned home. In fact, one child was very nervous, he was confused, he has even vomited." The moral panic from this and the fake news that followed resulted in a magnified media panic. For days, we had the news, these news were being reproduced in social media, in newspaper, in television, and then we had some titles like erotica in schools, underage homosexual acts, porn film in the class, sexuality education, sexuality lessons for 10 years old, etc., etc. And without the slightest verification of the data and of the content of the film, this scandal circulated en masse. And then TV panels and articles featured experts' opinions on the subject who, without seeing the film, were referred to the impact on the children and targeted the teacher who was chosen that film. And actually, the teacher chose the film from a platform that was created by the Greek Film Center in cooperation with the Ministry of Grace. So conservative circles had the opportunity to somehow coordinate this fake news, and the teacher who chose openly to address toxic masculinity and gender stereotypes in class have found herself in a very, very difficult position. And according to the European Children's Film Association, that fake news campaign it was an attack to the teacher, but also questioned the possibility of the educational process being enriched with themes related to equality and human rights. Can we discuss these issues, or we found ourselves as teachers in a very difficult position. And all this effort, according to the press release from the European Children's Film Association, was not unrelated to the fact that Greece was between two elections at the time, and probably not unrelated to the fact of the representation of some conservative, very conservative parties in our government, in our parliament. So the question is why we want teachers to be unprepared and scared to teach about sexual and reproductive health. As a teacher, I know how to teach, what kind of methodology, what kind of didactics I'm going to use to approach any subject. But as a civil servant, in addition, I need a direction and confirmation by the state on when, what, and to whom I address my teaching, which that means like a proper curriculum. We know that CSE is a value-laden subject, and the anti-CSE conflict on ideological grounds are pronounced all over the world. It was mentioned by Esther, it was mentioned by Patti. In that sense, Greece can become a case study of a Western democracy that tries to balance its existence between the liberal values, as these are promoted by the EU on human rights and inclusion, as well as the acknowledgement that comprehensive sexuality education is an evidence-based approach for healthy and safe young people, but at the same time struggles with more conservative, strong voices from the past. So, the Greek puzzle regarding the inability of the state to promote conditions that encourage CSE, despite the state rhetoric on the opposite, starts right from the top. And when the connection between education and religion is so close, as the case is in Greece when they are under the same political organization, liberal values on education, human rights, and LGBTQI inclusion are most likely challenged. Some examples: in 2019, the Holy Synod dedicated the first Sunday after Christmas to the unborn child. And a few months later, an expensive public campaign targeted women's abortion rights that Greek women have since 1986. The church and affiliated religious organizations has been actively blocking all efforts for introducing properly CSE in Greece. And nowadays, those opposing CSE are organized around political parties that they take up approximately 12% of the parliament seats. There is a part in the parliament that emphasizes in its foundation declaration its belief in the institution of the family, as this is directed by nature and tradition. And there is a new party that recently succeeded to elect representatives in the parliament that they are openly against CSE, and they are openly against abortions also. And they state as their mission to reframe the dangerous global narrative on our children's early sexuality. Both parties are using anti-CSE argumentation. For those interested on the subject, the type of argumentation, I can refer to the European Parliament Forum for Sexual and Reproductive Rights publication, Restoring the Natural Order, the religious extremist vision to mobilize European societies against human rights on sexuality and reproduction, and also known as Agenda Europe, as well as the European initiative, Mom, Dad, and Kids, which, as you see here, has a Greek sibling. The Greek version of Mom, Dad, and Kids is created and run by a coalition of Christian civil groups. So, although the last years, secular voices in Greece managed to gain victories for promoting human rights and LGBTQI inclusion and increase the public pressure to acknowledge such extremist groups and their phobic agendas. Still, in terms of education, little is done for proper introducing CSE in Greece. We need to deal with the existing problem of teachers training, production of proper educational materials, but that will not happen as long as we refuse to address the elephant in the room. Separating education from religion affairs in the governmental level in Greece could provide a breathing space. Taking the debate in the society is very important. We need to make known that CSE is about health based on health and healthy relationships based on scientific data, not some abstract moral ideology. CSE is connected to critical media literacy and part of an ongoing dialogue. CSE is the responsibility of a democratic civil society and the academic world. And finally, we really need to understand that CSE empowers people to realize their health, their well-being, and dignity. And in that way, they become decent human beings. And this is what we are dreaming as comprehensive sexuality educators, that we create and we help to have decent human beings in this world. Thank you very much for your attention.
Wonderful. Thank you so much. That was a fantastic overview of the many successes, but also challenges that you face in Greece. So I'd like to move us over now to hear a little more about Latin America. So if we could feature Mariana Cruz, I'd love to hear about what's happening there.
Yes. Hi, thank you, Kristen. Can you see my screen now?
Yes, we can.
Okay, perfect. Well, thank you very much for the invitation. It's a great pleasure and a privilege to be among all of you. I've been reading all the messages, people from all over the world, and of course with my colleagues of the Sex Ed Committee of WAS. Very, very happy to be here and to continue this conversation as we start envisioning our trip to Turkey very soon. So today I'm going to talk about a little bit the LAC context and how CSE has been designed and implemented in our region. I was just listening to Margarita, and it's very interesting because we have so many similarities. Like it's like this happens in LAC, like this happens in LAC. I think there is like a common pattern going on in all the regions around the world. But at the same time, I think that and this is something that I've learned by my colleague Esther, the historical processes, like what has happened in each of the regions has determined the way we perceive and we design and implement comprehensive sexuality education in the Latin American and the Caribbean region. So I will just move forward with the presentation. First of all, I'd like to share with you a little bit of the context. Of course, it's very difficult to provide a brief context of Latin America, but just very briefly, it is important to know that in the region, we have around 160 million young people. That's 1/3 of the youth world population. I'm talking about between 15 and 20 years old, plus of course all the children and adolescents that should start with CSE at very early stages for the reasons that we are going to be talking about. Also, Latin America continues to be the region with the second highest adolescent unintended pregnancy in the world. This is this has been the trend for the last almost 10 years. And it's something that I don't see that it's getting more complicated than before. Like the trend continues in that way, but it should make us think and reflect on what's going on with the policies, with the collaboration between the education and the health sectors in our region, and where does the problem is coming from. And I think also by providing a little bit of the context, you will probably understand a bit better what may be some of the causes of this situation. Also, the global adolescent unintended pregnancy rate is unintended and sometimes intended, like in the sort of context of marriage, especially at early stages marriage. It's 66.5 births per 1,000 girls aged between 15 and 29 and 19, sorry. In LAG, 34% of women between ages 15 and 49 have suffered at some time physical and sexual violence. And I'm connecting these two aspects. Let me move to the next one. Because also the sexual and gender-based violence rates in the LAC region have increased seriously. You know, sometimes I have the words in Spanish like that come to my mind immediately. But my point here is that, of course, we know that the COVID-19 pandemic hit us very, very dramatically to all of us, like globally, but the impact that it has on gender and sexual-based violence was huge. And the impact is still being seen nowadays. It also helped us somehow to make more visible what was going on in a region where it was sometimes normalized, where violence was very normalized, and where it started to happen at very early stages as well. It's not just exclusive to very young girls, but it was also like to young adolescents or young people, but it was also happening to very young girls. Again, psychological and emotional violence is one of the most common forms of violence in our region. We have a serious problem. 12 women die every single day in the LAC region due to what we call femicides. And violence and harassment in school has also become a serious issue, especially with all the migration processes going on in the region. It's not just about like people being forced to leave their countries for several reasons. There is like voluntary migration as well, but you know, it's not just about these kids leaving their own country of origin, it's also the people who are receiving these new modalities of, you know, teaching or receiving other students in the classroom. So we are facing a lot of challenges that need to be acknowledged in order to start giving responses, accurate responses, and pertinent responses, especially with a situation such as these ones, with situations such as these ones that may not change for a while, right? Like migration is here, it will stay. The trends, the studies, evidence is proving that we need to start resolving those issues. In this regard, what I want to say here is that comprehensive sexuality education, as we have already heard from Patti, from Esther, from Margarita, from Kristen, is central to children and young people's well-being and health, to equip them with the knowledge and skills they need to make healthy and responsible, and I always add, and free choices about their sexual and reproductive health, and of course to benefit from that right. Let's move on then to understand this context. Let's also move on to the evolution of CSE in our region. Again, this is, I have to say, I have to show off a little bit here. I've been really mentored by all my colleagues at the Sex Ed Committee. But of course, being close to Esther, who is like a reference in our region, has been like the best opportunity. I have to learn like about the processes and things that, of course, like many of us were not there to experience or to understand. But something that is very important to understand is that CSE in the LAC region is totally determined by our historical processes. By around the end of the 1960s and probably throughout like the 1980s, Central America and many countries in South America experienced like the dictatorships, which it's kind of weird to mention this, but somehow define and determine like the way we were experiencing our sexuality, and we were understanding how this would benefit or not our health, or how we could exercise our right around that. So in the 1930s, as you can see on the slide, and I think this was like a global trend, the approach was very biological, like it was just about the body, taking care of your body, and that's it. Like you would never, of course, you would never talk about pleasure or contraceptives or anything related to that. The 1960s, 70s, what I was just telling to you, like the political context was very complex in many countries in Central America and South America. But then at the same time, there were like counter movements reacting to those processes, to those political processes. And in that regard, we have, of course, the youth movements, like we started talking about safe contraception, feminist movements that have determined like the current context of the LAC region regarding like many other aspects of our sexual and reproductive rights. People's education, like it started to be considered as something to be taught in school. There was a more holistic approach. It was not just only about the body, but we were starting to incorporate like more issues and topics into the conversation. And we started to see the first CSE programs in our region. The 1980s with the HIV and AIDS, like determined, like changed the whole discourse around CSE. It was like, there was like a lot of preventive approaches around that, but still then there was like a new conversation. We were starting to hear that it was part of ourselves, like we needed to understand what was going on with our bodies, like how we could control like the fact of desiring or not to have family or to have, you know, children. Like we were like the discourse was changing. And in the 1990s, and I think this is very important, for the first time we start to talk about comprehensive sexuality education or just sex education as a human right. And I think this is very important because from that moment up to our days, and well, now we are here talking about this, it's amazing to have this opportunity to have these spaces where we can actually talk about this, exchange some ideas, learn from others. Before that was basically sort of impossible. And now we have like different approaches and different ways also to approach the conversation about CSE. So we have, of course, the conference in Vienna, 1993, where we started literally to talk about human rights. The International Conference on Population and Development in Cairo in 1994, which was like breaking point to start like a whole new conversation. And well, and it was actually not a whole new conversation. We had all this background behind us, like following us, determining like how we wanted CSE to happen. And then we have the fourth Women Conference in Beijing in 1995, which connected perfectly well with the previous conference. And we were starting to talk about women's rights, like their own decision, like their own possibility to take their own decisions about their bodies. In Latin America, what we see, it was complicated to color this map because there are many changes going on in terms of legal framework. What we see here, for example, in pink is these are the countries which have a law, but for example, the only country that literally have a law on CSE would be Argentina. I added Colombia. There is like a specific law in Colombia. I was just trying to define whether it would be like in sort of a policy or under a law, but I ended up like it's very good, like the approach they are addressing in this law. So I ended up putting that color. But what I want to show you here is that all the countries that are colored have something like a legal support to provide CSE. There is not a single law in the region that forbids us, like prohibits to implement CSE, but we know that there are some countries in the Caribbean, for example, and in Latin America, where CSE is really hardly implemented. Like there are many challenges. These are very complex contexts. And even though there are like no legal frameworks that prohibits or allow this to happen, there are no like very specific actions around CSE, around the rollout of CSE. In the LAC region, we have two sort of like guiding documents or declarations that are like our guiding documents and that have like contributed tremendously to really make some improvements and monitoring about the implementation of laws and the implementation of programs. We have the LAC Ministerial Declaration, Preventing Through Education, that was in 2008, that was in Mexico City, and the Montevideo's consensus that took place in 2013. It's about to turn, like it's going to be its 10th anniversary. We won't go into the details, but something that I want to, to share with you about that is that in the declaration, Prevention Through Education, we had this definition about comprehensive sexuality education, which, I mean, you can read it, it's on the slide, and we can share the slides afterwards. But what I want to highlight from this definition is that it's very comprehensive. We are actually addressing like a holistic approach of CSE, a very comprehensive understanding of the biological aspects, the emotional, psychological, like all the aspects about the human integrity. And of course, we are linking that definition to a human's right definition. This is going to be very important because this sets up like a lot of commitments from the Ministries of Education and Health back then to really start like thinking about designing curriculum content for the students, for learners in their different countries. And it was like a ministerial commitment. So that sort of like set up like another, again, conversation about CSE and the acknowledgement of CSE as a human right as well. What happened then, we all know it has been very challenging, but we are still trying very hard to advance CSE in these countries. So in the region, as in, I would say in any other region, it's very important to understand CSE in our region from a very critical and objective analysis. Although we are one single region, we have so many different contexts, but extremely different contexts, that it's really important to understand what the learners are needing at that moment, at specific moments, what's the political context, what's the social context, like how are families perceiving education, CSE in their own countries. And then we also need to understand like our backgrounds, the historical processes of each of these countries. Again, some of them have gone through very severe political processes. Some of them are experiencing a lot of violence at this moment. So we really need to understand what's going on in each of these countries to really customize or adapt or develop content that is relevant for their populations. Also, we have transitioned from a biologist preventive approach to a human rights approach. We are talking about this. Before, it was not a discussion. It was nothing we could say about this. Now we are talking about CSE as a human right, and that needs to be also enabled and guaranteed to allow young people to benefit from good health and well-being. And that's something we need to guarantee, and that's why we need to keep advocating for CSE in our region. And we have reached several consensus, and as Esther has mentioned already, it's time to start working together, to really stop working in silos, to really start connecting among ourselves, to really organize ourselves for a standardized or a common conceptual framework. We need to start working together. I think that's the only thing we're missing. There are very good, like there is good progress in this regard, but there is still a lot of things to do. Oh my God, my time is running. Okay, so about the challenges. What we've heard from teachers specifically, it's, for example, that there is a lot of lack of teaching materials. Margarita was also mentioning that, sort of the same in Greece. There is insufficient monitoring of CSE, how it is implemented. There is lack of training and support to teachers, and that has become a serious concern for some teachers. And for example, based on a study that was published by UNESCO, 1 in 5 teachers confirmed feeling embarrassed to talk about CSE. And this is something I've experienced myself. Like when we provide like teachers training, their main questions is not how to address a specific topic, is how to start the conversation with their learners, with their students. Of course, one challenge are the budgetary restrictions. And also, sorry, this was another title, but, oh, sorry. I never changed my slides. I have them here, but I wanted, okay, so these are the challenges I was just talking to you about. Then we have these other challenges, which is like the social movements that are against the implementation of CSE. We've talked about that already. There is a lot of misinformation out there and lack of evidence. I think there is a lot of fear, and I agree with Margarita in this regard. There is a lot of fear, a lot of judgmental approaches, stigmas and prejudices around CSE and around like all the things that happen and are taught through CSE. There is like CSE that is not relevant. We as CSE trainers, we also need to acknowledge that sometimes the content that we are developing is no longer relevant for young people. We need to start working with the educational community. And there is also like a lot of misuse of digital resources, which has resulted like in all the consequences that we've seen. I'm almost there. So there are as well many opportunities. Not everything is so bad. So there is a lot of evidence on the effectiveness of CSE, and we need to disseminate that information. I think that's what we are lacking. There is a lot of evidence, but the evidence sometimes stays in the book, and we are not, I don't know, like appropriately disseminating that information. We need to start working with the whole educational communities to communicate with the families, with key stakeholders, with young people, and we need to rely and trust on these different historical processes. Like we've learned something from that, let's leverage on those learnings. And the other opportunities is develop content that is pertinent and relevant for youth. That's something that has been done by different local implementing partners in the region. Also, like if we are working on content for families, let's work with the families to work, to develop the content that is for them. Like what is what you don't understand? How can we approach it differently? And the same for all the targeted audiences. We need to start also engaging with different communitarian actors. There are wonderful experiences from all over the world about like engaging with religious leaders, like communitarian leaders. Like there are many other ways to approach young people with CSE. And I think it's our moment, it's the opportunity to acknowledge that CSE is a human right. And that's why we need to guarantee and to enable all the platforms and all the resources that we have in our hands to make that happen. That's all on my side. Thank you very much. And sorry for taking 2 more minutes.
Do not ever apologize for taking 2 more minutes. That was fascinating and really great. Thank you so much for sharing the perspectives from that region. So I would love to take a moment and invite everyone to think about what kinds of questions this has brought up for you, and what kinds of ideas you have. And I'd also like to point to the fact that our WAS Congress is going to take place November 2nd to 5th. And there's been a few links posted in the chats along the way for you to gain information about that. And we're very fortunate to have the chair, the host of our Congress, Mehmet. Could we possibly have you speak up for a moment and just say hello? If that's possible, great. And the registration, I'll post the link in the chat again. Registration for the World Congress is open, and I'm the vice chair for the scientific committee, and within the scientific committee we have several different areas of focus, one of which is sexuality education. So if this is your area of passion, your area that you want to contribute more to, this is a really great place to understand the work that's going on in that area. And I see that we've got Mehmet here, if you'd like to say hello.
I don't think I can have visual access, but if you can hear me well,
we can hear you.
I'd like
Great.
to thank all of you for the brilliant presentations. And it's a great pleasure and honor for me and for our association to take people's active participation in the upcoming WAS Congress that's going to be held in Antalya, Turkey, between the 2nd and the 5th of November. So I guess that this is one of the webinars before the Congress. On the next occasion, I'll be happy to join you and to introduce the Congress. But this is apart from the Congress. This was a very important issue, sexual education. And I agree that in Turkey, we had the same stuff, the same kind of problems that one of our colleagues has presented in here. We didn't have, when children wanted to ask about sex, they went to their parents and they said, go to your teacher to learn about the answers. And then when they go to teachers, they say, why don't you ask your mom? So they were kind of, we always say that the sexual education is from birth to the death, but unfortunately the education is done on the streets. So there's no address who gives these educations and so on. So we actually established a book many years ago, according to the age groups, not only for the children, but also for the parents and the teachers. And this was in the beginning of 1990s, and it's now 2023. And unfortunately, that big book, which had many sponsors and which was also sponsored by the Ministry of Education, is not existent anymore. So it's going worse and worse, and it's getting thinner and thinner. And I think it's a human right to have sexual rights, as Esther has based everything on human rights, and also, about these important issues such as, you cannot think of sexual education as a kind of education which is not different from the others, because it's part of life. And I think you all made wonderful contributions, and I'm hoping that we are going to talk further and even more thoroughly during the Congress. So I would like to thank you all and for giving me this opportunity to talk. Thanks very much, Christine, to organize and to have this Congress available to all of the people who are interested in the area. Thank you so much. Thank you to all of the speakers once again.
Thank you so much. And we look forward to seeing you in person in Turkey very soon. So thank you. We've got a few questions that have started us off here in the question answer. So I'll start with the first one, which is understanding more about how sexual and reproductive health services are accessible to adolescents to address their mental health issues, and how sort of sexual and reproductive, I'm reading this as around how sexual and reproductive health access is related perhaps to some of these mental health issues, evidence showing that there's school dropouts, performance gaps, and stress, and how all of this is related to mental health. So has there been, from our panelists, has there been anything that you can think of, tools or experiences that really engages schools and parents in addressing mental health in conjunction with sexual and reproductive health? Who would like to start? Anyone?
Okay. I don't think that particularly with mental health has become a very important question and matter after the pandemic, because it was seen, what effects of confinement have and isolation have on children, young people, and even adults. So it's a major issue now. But I think that over the years, the connections are there all the time. We don't speak about sexuality, as an isolated part of our being, but it's part of the whole area of personality development. And in that sense, many of sex educators are psychologists. So they work well into, there's a lot of work of connecting work in this field. And I think that in many cases, it's advisable to involve parents. And this has been done all over the world. There are experiences in involving parents and communities, precisely in sexuality education within schools and out of school. So I think that if you go into best practices, come to the Congress and you will hear local experiences which address these particular issues. And if you have any questions and you have any experiences and good practices, come and show them to us.
Mm-hmm. And I think that is, it's so, you can't ignore mental health in discussing sexual health or in discussing any sort of health, right? And that is something that, as you noted, mental health is so integral to overall health, just like sexual health is. And you mentioned that there's, since the pandemic, there's been a greater emphasis on this. And I think what the pandemic really did for a lot of people is put a spotlight on how important it is to not ignore that component of it. And when it comes to sexual health, especially adolescent sexual health and sexual development, that's a time when mental health is so important. Did any of the other panelists want to add anything else to that before we move on? We've got a whole list of questions here, so plenty to, Mariana, did you?
Yeah, I mean, I think there is not enough information about the intersection between CSE and SEL and social emotional learning. I wanted just to share like this could be helpful. There is this resource that was recently launched, and it's just talking about that. And I think it's just we need to figure out some innovative ways to connect them. So I'm just sharing this, I don't know, on the chat probably. It could be helpful, and it's like a whole set of tools that is providing a lot of social, psychosocial, emotional support, and yeah, PPS and then SEL. So Margarita, over to you. Sorry.
Okay. What I want to mention is that when we discuss about comprehensive sexuality education based on human rights, it's also one way to address the problems of people who belong to minority groups are facing. And very often these people, because of bullying, because of stereotyping, because of prejudice, societal prejudice, feel in their health the result. And nowadays, more and more parents are interested in growing up their children in a safe and inclusive environment. So I believe that comprehensive sexuality education is one way, a very good way to address these issues and to help teachers help their students and the families with also problems that young people can have because of not being accepted, because of not being recognized, because of not receiving appropriate help, because of not being visible. So this is also connected, I believe.
Yeah, you mentioned something about human rights, which is related to one of the other questions here, about whether sexual health education is considered a human right in the United Nations. And I think many of you on this committee can speak very strongly to that, given all the work that you've done on the declaration from WAS. So would one of you like to highlight that?
Well, I'll just be very brief on this. Sexuality education is not considered a human right, but education is a human right and recognized all over the world. And nowadays, education, inclusive education, cannot be considered without considering comprehensive sexuality education. And this is seen in the SDGs, in the Sustainable Development Goals, as goal number 4, education. So if we make sure that sexuality education is seen as part of inclusive education, of the overall framework of education, then, I mean, not officially, but we are struggling a lot and we are working a lot precisely to make it clear that comprehensive sexuality education is part of inclusive education, inclusive and quality education.
Yes, yes. There's 2 questions that can be combined here, of really about what are some of the concrete strategies that we can all implement? And one participant said, you know, as someone who's like boots on the ground, what can we do to help move forward toward our common goal of making this available to all humans? And sort of what concrete strategies can be implemented to offset some of those challenges that many of you highlighted in the different regions? Yeah, Patti.
I'm not sure I'm going to be able to answer this directly, but I want to highlight what the intention of the SEC at WAS has for our participation in the Congress in Turkey. Part of my observation from being on the committee and from listening today to these really incredible case studies in terms of region or a country or the global outlook that Esther has presented so beautifully is that there is no one size fits all. And I think that we all hunger for that. You know, I'm sitting here thinking, well, in the United States, we have national guidelines for comprehensive sexuality education that is about DEI, that is about inclusivity, that is truly about human rights and based on that. And yet, does that apply or fit everywhere around the world? Because we have to be culturally sensitive and culturally relevant. And I think that our mission as part of the Sexuality Education Committee is to try to push forward toward a framework that has many more applications than just a region or a country or a culture. And in fact, we will be presenting a panel at the Congress, which unfortunately, to my knowledge, will not be available virtually. And that is, what are the strategies that we all can employ globally to address the great challenges? Because there are two different discussions going on. One is what should be included, and the other is how do we combat the erosion of comprehensive sex ed? We are under attack globally, and we are in a great time of divide around the world. So I wanted to be able to share that.
Yeah, that's I think that divide many of us are feeling, and that's something that we have another question here from Luis about how we can make more use of extracurricular sexuality education so that it's not so much the prey of politics. And it sounds like you will be presenting on some tangible strategies to do that at the Congress. So that's a fantastic plug for that session. There's another question here around trauma and how any of you have seen trauma-informed approaches or interventions that incorporate trauma-informed care incorporated into CSE in your areas. Has there been any examples of that you can think of?
If you're referring to sexual trauma, there's trauma processing therapy by Patricia Rizik, which has been written many years ago. So obviously all of the treatments are based on evidence. Evidence-based treatments are the ones who are focused to the trauma. And there is a kind of, if you can download it, you will see that there is a large cumulative kind of information done many years ago, but by Patricia Rizik on sexual traumas. So it is a CBT approach, cognitive behavior therapy approach, and it has been there for more than 2 decades. So this is one thing, trauma processing therapy. So this one is this one, and of course there are new ones, but this is a classic one, and it just brings up all of the issues related to sexual abuse and sexual harassment. And for the other question, I could always say that I'm totally agreeing with Esther. Well, what is the goal of school education? One goal of school education is to prepare the youth for their future lives. And sex is one side of their future lives, so it should be part of the education if the school's aim is to prepare them not for being intellectuals, but being part of this life. So they need to be aware of the sexual issues. Otherwise, they will learn it from sources that are not reliable and that cannot be, trusted, and we have lots of disinformation. I think sex area is the area which is most occupied with lots of myths. The number of myths in the sex area is the highest one, I guess. So I think it should be part of general education, and we need to keep in mind that education is a human right, and sexual education is a specific but important part of the general education.
Yeah, and that is related to 2 of these other questions around how do you do that in knowing that education is a human right and that sexual health education is so important to human development in settings where you're dealing with very conservative societies or very highly socioculturally religious societies where there's quite hostile approaches to this and no approach because of that. What are some of the ways that you have seen have been successful in navigating those types of contexts? Yes, Margarita.
What I have realized by working with parents and teachers, who are also parents, most of them, on the field of sex education, is that they really understand what we are talking about when we start discussing the goal. We want to help children to create and be healthy and form healthy relationships. And then when we take the goal, which everybody accepts, all parents want their children to be healthy and safe. And then we use some data saying, for example, what is the impact of non-education? What is the impact on children's health and young people's health, and the choices they make without knowing all the data regarding contraception, regarding relationships, etc. So I believe that the most important thing is to discuss these issues, to talk about them. Most of the people in Greece are, and I think Mariana mentioned it, that they don't feel so comfortable to start talking about it. But then when we talk about it and we discuss these issues and we present the data saying how education can improve the life of the young people, then I think that, or I have seen it, parents can become really good allies and teachers can be involved. So that's probably one way.
Yeah, that's great.
What we did was to make a comparison, a kind of research, where, because this sexual education was based on being volunteers. So as long as the parents accepted them, the children, they were allowed to get the education, because obviously if people didn't want to send their children for classes regarding sexual education, you can't push them. So that was the idea. So what we did is to get those volunteers and then kind of make a comparison between that group that accepted to have the sexual education and the group that didn't have the sexual education. And we wanted to follow up these cases for about 10 years to see the outcome. So obviously this might help things like that. But on the other hand, of course, there are obstacles, because, putting sexual education in schools does not include only one group. You need to get the approval of the Ministry of Education. You need the approval of the Ministry of Health. You need the approval of the parents. So if somebody wants to break in and say, well, I'm not interested, obviously you can push them. And then one group takes it and the other group doesn't, it just kind of polarizes the students and also polarizes the parents as well. So there are many obstacles to that. But I think as time goes by, not only leaving it to time, of course, but doing something for it, doing research, showing it, and showing the differences between the two groups, and not making it so, let's say, well, I think things change slowly. And as you all know, small is beautiful. So you have to start with small things. You can't expect the whole world to change in one day. But if you do small bits and pieces, like if we stop trying dropping one by one, and if we join, we become the ocean. So I think not dropping one by one, but coming together and making a global kind of, perhaps taking a global perspective might change things. And of course, I know that there are barriers, but lots of, even in those countries where there are lots of barriers, like I was invited to many Arabic countries to give about sexual issues, information and education on those. But uninterestingly, they said, you need to be a Muslim for that. I mean, it is okay for me to go there and to talk to them, but if you're coming from a different religious group, then they didn't accept it. So I think the cultural issues, the religious issues, there are so many aspects of this issue that emerges once you start, doing something for it. But
And
I
then
think
that's a wonderful place for us to end here
Right.
and to in this idea
Mhm.
that small steps make a big difference. So I hope that all of you who joined us today, thank you so much for joining, that you have some small steps that you can move on with you into your day. And thank you so much to all of our panelists. And we really hope to see you in Turkey for the World Congress for WAS. So thank you so much. Take care.